Namaste, I am Dr. P.V. Bhandari, a psychiatrist from Udupi. So today the main aim of this video is to talk on the contemporary problems we see between aged parents and their caregivers, usually their children. So as a psychiatrist, what I notice is there is a sort of a gap between the children and parents, and especially as they grow old. In fact, parents as they grow old uh, fail to understand their limitations. They are still in a mood to say that their will should prevail, what they say should be carried out, and they try to tell the children that you do this, you do that, and children get angry. They feel that they are being pushed to the corner, and the parents, they fail to understand that children have their own life. They have a way to go further in their life, and they cannot always be the center of attraction. And children at some point of time, they also forget that their existence is only because of their parents. They have taken care of them when they were young. So probably these were things which were earlier also there, but now they are coming into the forefront because number of caregivers are less. Earlier we had a family with 10 children, 11 children, and like if there was a problem, if the elderly, if they had any problem, there would be at least 4 or 5 people who were sensitive enough who would share the burden. But now what has happened is it is basically nuclear families. So this generation gap, this difference of opinion now has started entering psychiatrist chamber more often, because I can say in the last 25 years, currently I am seeing more and more of aged people coming with their children, sometimes alone. And what I have noticed, I am just telling you. One thing is, I hear complaints from the elderly that nobody bothers about me. They have left me alone. I am alone in the house. I have no help. Or they are there, but they are not there emotionally for me. They are in their own world. They do not have time for me. They come and they go. It is like I am staying in a hotel. These sort of things. And the children, they say, I am really fed up. Every day he tells the same thing again and again, and of late he forgets important things. I would have kept food for him, and he doesn't eat it, and then complain to everybody that nobody is giving me food. And he is very rigid. He is trying to impose not only on me but also on my children. This is unfair. So these sort of things, I feel a dialogue is very much necessary between both the generations. Somewhere down the line, I feel elderly should understand that they should not compare their life with others or compare the current life with their past, because as times change, there will be a lot of changes. Our body also gets worn out. We have our own limitations. I remember an old lady who was living alone till the age of 91. From the age of 85, she decided she will not go out. She will not go out of the house because she knew that she had issues. That she would fall, she would have she would have a feeling of giddiness, and she stopped having any expectations that somebody should take her out. She was living happily. She had a phone in her hand. She would call relatives, talk to them for hours, but never have any expectations that somebody should come and visit her, somebody should talk to her nicely. She had two servants who were looking after her basic needs, and she felt happy with them, looking and lived happily with them. This is something which I have seen. So, somewhere down the line, elderly should probably think of this. They should reduce their expectations from others. And coming to the youngsters should understand that if the elderly are talking of memory issues, or you notice that you have given them food, but they have not taken food and they have been complaining, it could be some major medical issue. It is what is called as dementia. See, what happens is they forget uh, day to day events, or they forget that they have been given breakfast. This can happen. Then they may have confusion towards the evening. Morning they are fine, but as the evening occurs, they start becoming unaware where they are. They start becoming restless. They don't sit in one place. So elderly can have a medical problem called as delirium, because they are on multiple medications. Even something like a urinary tract infection, or sometimes a respiratory tract infection, some of the medications used for treating these things can cause this confusion. So the youngsters should realize that if there are issues with the memory, or if there are issues with their behaviors which have occurred suddenly, this could be a medical issue. I have seen people neglecting it. I again am reminded of a family which brought its disputes to me, where I noticed the gentleman who is around 80 years of late had started suspecting his wife. He was telling that his wife is having affairs with others. Now the family felt very infuriated. They said, "How can he think like this at this age?" And I think he is keeping some unconscious issues, or things which were in his subconscious, not unconscious, subconscious, that is being brought out now. But actually, after assessing the person, I realized that he was suffering from this early dementia changes. In fact, when we got the investigations done, there were a lot of changes in his brain, and now with the appropriate medications, his suspicion has come down, and also family has realized that it was a mistake on their part. In fact, they took almost 7 to 8 months to come to a psychiatrist. So somewhere down the line, I feel a rethinking has to occur on both sides. I mean, the elderly, as I said earlier, should make a introspection on the way they behave with children. Maybe children have their own life. They would be tired when they come home, and if we go on talking our problems, they may get irritated. But at the same time, children also should understand. See what the elderly need in the last days. One is they need good health, taking them to a doctor when needed. Then, of course, their medication management. This is something very important which I would like to tell you. I have seen some of the elderly, they have money, they buy medicines, but they get confused which medicine to take when. I've had instances where a elderly man, he took a insulin which was supposed to be taken in the morning at night, and what was supposed to be taken at night he took in the morning, and suddenly there was a period where he fell down unconscious. In fact, the children realized this after they saw the CCTV clippings. Of course, he was saved, but I feel there is a need for sensitivity among children, and especially with regard to medication management. Nowadays, there are a lot of technology. There is these pill boxes available where medicines can be kept by children, and the elderly can take it as and when they want. And I think children should forget some what do you say, preconceived notions that okay, elderly means like this. Deal with them one day at a time. So forget the past, even if they have irritated you. Many times you should understand that as we age, we also become constricted. We are all today, we may be middle aged, we also will become aged as the years move on. So understand that and also help them. See, basically the elderly require help in one is pill management, another is fall management. This is what so maybe things like early use of walking stick should be encouraged. Then having a non-slip mat, a sidebar in the toilet, these sort of changes children should think and do it early, so that the elderly are in a comfortable position in their lives. So overall, what I feel is uh, this discussion has become relevant today because the old age population has increased in our country, and number of caregivers are shrinking, because earlier families were all joint families. If there were 10 or 11 children, 4 or 5 at least would be sensitive enough to look after their parents. But now there is one child and he also has lot of stress. Don't forget this. The caregiver, he is also another patient. Many times when I see patients with dementia, especially dementia or some chronic illnesses like cancer, or patients with the diabetic kidney disease, the caregivers also become patients because they forget their self care. They do not exercise. They are spending a large amount of their income on the health of the elderly, so they become frustrated, and they also notice that elderly do not recognize this, so they also become patient. So my earnest appeal is elderly should be taken care of well by youngsters, but the youngsters should also not forget to look after themselves, and whenever in need they should take help from others. See, what happens is we never think of others, or we think that others may not help us, but what I have seen is there are a lot of exceptions to these sort of things. There are people who are willingly helpful to look after the elderly, they give them help. So the basic problem is we do not ask. So don't shy away from asking for help. And also, please understand that if you are healthy, you can look after your parents in a healthy way. So I think these problems will become more and more common in our country. And what I have noticed is there is some sort of impatience in both the sides. In especially, I have seen elderly telling, instead of living here, let me go and live in a old age home. And I have also seen children telling, if you behave like this, I will put you in a old age home. See, somewhere down the line, we are trying to stigmatize a old age home. Please understand, if an elderly can manage to live alone and wants a group living, to live with people of his age, today, old age home can be a really good place. Please don't have a misconception that old age home means it's a place which is unwanted. Definitely not. In fact, that is the reason probably why old age homes are increasing in our country. And basically, I have seen people living in old age home also living very happily. Children do come and visit them. So here, what happens is children are in their world. They, and whenever they have time, they visit them. I have seen children, they have kept their parents in old age home, but always talking to them 3 times a day, always inquiring about their health, and whenever there is a need, they come down. I have seen people coming from thousands of miles away to look after their parents. So what we should understand is as development is more in and around us, and as these nuclear families come, these sort of situations are going to be there. Let us prepare for that. Thank you.